Hey guys, this is Krish V, your favorite PAC. Thanks for tuning in for another video. Today we are going to talk about Italy and the crisis that happened over there. First and foremost, guys, I want to say that nothing on this video or on my channel is medical advice. This is just for entertainment. Please talk to your medical provider for all medical needs. This is just for entertainment, all right? So I'm sure most of you have seen the situation that occurred in Italy with the virus. I mean, it was pretty hard not to see that. The media really blasted it everywhere. You know, it was just massive amounts of fear coming from all over, and you know, for a pretty good reason. But I mean, they never really educated us on the Italian healthcare system, why Italy had the reaction it did. But Krish, what are you saying? You moron! Italy has one of the best rated healthcare systems in the world. Well, you're right. Italian healthcare is one of the better healthcare systems in the world. But remember that it is a free universal healthcare system for the people. So what does that mean when most of the people in Italy opt in for free healthcare versus private healthcare? When you have a system that's built on free healthcare, then you obviously cannot have an abundance of healthcare. Healthcare is expensive anywhere in the world, and you know, in Italy a lot of the healthcare is locally and regionally funded. People in Italy do not have to pay much money to see their doctors. They don't have to pay much money to, you know, get examinations and testings and you know, imaging. So what that ultimately means is that, you know, medical providers there don't make, you know, a fraction of the money that they would make in America. There's not a huge abundance of doctors and nurses. They don't even have certain positions that we have in America that help support our hospital staffs and our nursing staffs. This also means that people aren't lining up and, you know, competing, you know, rigorously to try to get into the healthcare field. There are many doctors in Italy who don't even make appointments for their patients. It's more of a first come, first served basis, and you gotta pretty much hope that the doctor shows up, or else you have to, you know, find another location to try to see a doctor. I'm sure you've seen the media post pictures and videos of the healthcare facilities over there being overrun, you know, not enough beds for patients. Well, that's because they didn't have the infrastructure for something like this. I mean, most countries don't, but when you look at a first world country and you see that, oh my God, like their hospitals are just overpacked and, you know, they're having to choose who lives and who dies, it was because that whole healthcare system wasn't built for anything close to that. Now let's take a look at why the virus was so pertinent over there. One, if you look at the demographic of Italy, the average age is a bit older, and when you look at when this occurred, the temperatures were a bit cooler. It was one of the colder months in Italy. And remember what we said about viruses being opportunistic infections. When you look at the data from Statista.com, it shows that 85% of the people that died were over the age of 70 or older. 95% of the people that died were 60 and older. So pretty much there was a ton of old people in Italy getting sick from this virus, and that's understandable. Now let's take a look at what happened in America. In America, when the virus hit, what did we do with our healthcare staff and facility? We actually furloughed a lot of our healthcare workers. A lot of our healthcare workers were not working during this crisis. I think New York was the outlier. They had a period of lots of infections and lots of hospital admissions, largely because they are a highly dense population and they use the subway systems. Those subways are like incubators, just germs just passing from one person to the next, super easy. I personally have family that works in the healthcare field. I have lots of family in the healthcare field, nurses, doctors, respiratory therapists, and I talk to all these individuals, and I talk to my colleagues from school and different places, and a lot of them have said that their hospitals weren't necessarily super busy or overpacked or anything like that. A lot of them said that what happened was we cut so much of our healthcare workers. We cut them, we put them on furlough, so there was a short staff working in the hospital. People were required to do multiple jobs because they were so short staffed. So there was a short period of time where I stepped away from my current practice, and during that time I was like, you know what, I want to help with the COVID crisis, because I thought there is a demand and hospitals need our help. So I submitted my application to different COVID relief places. I applied to places like New York, all over, and I didn't get a single call back. Actually, there was one place that did reach out to me, and they just said, "Oh, we're looking at how the situation's playing out, and we'll let you know if we need anything." And that was very confusing to me. So then I started reaching out to my other friends and colleagues, travel nurses and travel PAs, and I started asking them, "Hey, what's going on? Like, are you guys working? What's how's the situation where you are?" And they were saying, "No, like our contracts have been cut. I'm looking for work." And this is all very unusual because the government is printing trillions and trillions of dollars, and you would think that in a pandemic crisis we would be giving money to our hospital systems to help them during this time. But instead, we are printing trillions and trillions of dollars and putting it back into the stock market because, God forbid, those billionaire hedge fund owners lose some money. Guys, I just want to say that I know that this virus is real and it is a real threat. It is something that is very dangerous, and we need to take precaution with it. But the truth of the matter is that for years and years, different flu viruses, different cold viruses, they have always been very threatening, especially to our elderly population. People that have severe autoimmune diseases, cancer patients. These things have always been a serious threat. I feel like right now there is a massive microscope on this situation right now. Alright guys, well, I hope you enjoyed this video. If you did, please hit that like button. Please subscribe and share this video so more people have access to it. Leave a comment below, tell me how you feel about this situation, and I'll see you on the next one.